The cost of private healthcare in South Africa continue to rise. It is estimated that 8 million South Africans have private medical aid and a further 8 million that pay for private healthcare from their own pocket. For more on this, I'm joined by ProfMed CEO Craig Comrie. Craig, very good afternoon. Thank you for speaking to us. Now, when I was doing some research, it suggests that the cost of healthcare in South Africa is comparative to anywhere in the world.
Yeah, absolutely. So, in fact, our healthcare tends to be more efficient and better priced than elsewhere in the world. But in the long term, we seem to be losing some of the battle. The demands of COVID has really meant that healthcare resources are stretched, and the global attractiveness for healthcare workers means many of our local skills in the healthcare sector are actually moving to those global destinations.
Now, the cost of healthcare has been increasing over the last few months. What are the reasons for the increase?
Yeah, there is a few drivers. One of those is specifically the fact that there's such a shortage of healthcare skills. Dr. Pathler, the Minister of Health, actually indicated in a recent parliamentary address that our doctor-to-patient ratio has actually declined over the last few decades from 3,000 people to one doctor to now sitting just close to 1,300, or sorry, the reverse. So what we have seen is that we've got fewer doctors to patients, and with those fewer skills that we have, we then actually see ballooning costs in trying to access these doctors. If you have tried to access specialists recently, you'll find significant waiting times to actually get access to these specialized skills. And we see the same effect in our nursing space as well. We probably have about 20,000 nurses too short for what we need. And so naturally that means that even the salary demands of nurses would go up. And so that is one of the drivers of healthcare inflation. Another one specifically that's not unique to ourselves is the fact that we have an aging population worldwide. People are having fewer kids, and naturally with an older population, there's a greater demand on the services of healthcare. And with that greater demand, obviously, people are seeing doctors more often, and naturally that drives some of the inflation. In fact, the inflation rate when it comes to healthcare, so different to CPI, usually sits on about 3 to 4% higher than CPI. So if we think in consumer price inflation this year is probably going to average on 5.9 or around 6%, we're talking about healthcare inflation sitting closer to the double-digit 10% mark. And when salary increases are usually around 6%, that double-digit healthcare inflation definitely makes healthcare less affordable for everybody.
It certainly
Whether
does.
it is in the medical scheme side or even in the public sector, those costs will be rising.
It certainly does, and I wonder about the comparison to the cost of healthcare elsewhere in the world where individuals are getting salaries year on year. Now, if you look at what's happening in the labor market in this country, there are certain institutions, organizations that are advocating for 0% increase. Is it fair then to say that our healthcare is still comparable to that overseas when the salaries aren't?
Well, there's still a big part of our healthcare that is contracted by even the national health systems overseas, because our services are far more reasonably priced. We've seen some of the healthcare tourism even come in, people from both the African continent and from elsewhere in the world come to South Africa because of the prices of healthcare procedures being so low here. So we are competitive in that space, but we are not competitive when it comes to the wage inflation or the salaries that are being offered at the moment. And that's a constant pressure then on the affordability that lands up, and people have to adjust their budgets. We need to do better in terms of managing healthcare inflation, and the only way you can do that is either by producing additional healthcare skills. So we need to produce more doctors, probably invest in some private institutions that can actually open up medical schools here in South Africa, just to create a bit more of the supply side when it comes to those skills. And we need to revert to better technologies that actually do create savings.
Now, I don't know if it's fair to say that a lot of people would come from overseas, because well, certainly if you're coming from overseas and you've got the pound or the US dollar, healthcare is certainly going to be a lot cheaper. But across the continent, if you come into South Africa, it's because of the quality of healthcare and the fact that in many African countries there's limited to no healthcare to speak of.
Yeah, there's no doubt that we have a very highly appreciated quality when it comes to the healthcare services we provide, and they are comparable with the rest of the first world. And so we get not only from Africa, but before COVID came, the healthcare tourism market was certainly growing for South Africa. It's one of the indicators. It's not the only indicator of how affordable South African healthcare is. But we have to do better. We have to actually create far better pools of resources so that we can improve on our pricing for South Africans.
Now, please answer this for me, because many conversations have been had by individuals who talk about outside of the trinkets that will come with being in a hotel, that a hotel room doesn't cost as much as a hospital bed, outside of the fact that you're going to get some treatment from a specialist.
Yeah, in fact, the expensive part often in terms of the treatment is not the so-called hotel stay or the hospital bed. The expensive part is the fees that are paid to very highly skilled and very few specialists that perform those procedures. Some of the expenses also that drive the cost is the new technology. We have a lot of new diagnostic equipment that's coming to the market, and those in many ways are life-saving in terms of early diagnosis. But that equipment or medicine, we're talking about biologic medicines coming through, cost a huge amount. They may be life-saving, or they might just extend life and improve quality of life. But they come at huge costs, and that's what is also being covered in the local market as well. The exchange rate does factor into that, so as we see exchange rate fluctuations, that does actually drive some of the increases we're experiencing.
Well, you mentioned COVID. Let's talk a little bit about COVID, and what impact has COVID had on the cost of healthcare in South Africa?
Well, we had two parts of the COVID that impacted us, and from the medical schemes perspective, we actually saw many people scared to go to a hospital and have the typical procedures actually done. I think the negative part of it is we had people that should have been diagnosed, and an early diagnosis might have saved a long-term, more severe outcome. And so we did see some of that happen, but from a medical scheme perspective, many of the claims dissipated for many of the waves during COVID. It was replaced, however, by those COVID expenses. So specifically on our scheme, we saw a lot of our healthcare-related workers who are our members in the front line be infected and reinfected with COVID, and certainly that made a big impact into our claims patterns. And so we see a little bit of the offset. In fact, in 2020, we see some schemes save up to 10% of their annual claims, while other schemes operated very close to a break-even type of space with what they projected in their budgets. So that savings did come through. What we've seen in 2022 is a bit of the pullback. We see some of those procedures return and a little bit of the catch-up. So we've seen a lot of orthopedic-based procedures actually happen at the start of 22 for those people who were scared to get into a hospital during the COVID pandemic.
Craig Comrie, appreciate your time this afternoon, and he's the Chief Executive of ProfMed.